Surgeons, when they go to do surgery, it's like Pandora's box. We have technology that allows us to look into patients' bodies through imaging. We have the experience that we've built on doing this for a long period of time. But what you find in the surgery is actually something that you can never predict.
Simulation is one of the fundamental things that we need in surgery to allow us to improve what we do every day.
Every single 1 cc of blood loss counts. Every minute in the OR counts. And therefore, if we can shorten that by practicing our procedures prior to going into the operating room, it's of really true value. I wanted a model that feels, looks, and reacts like a real live organ. So it needed to bleed, it needed to expel fluid-like substances, it needed to feel correct for the surgeon. We started really thinking around one of the novel procedures that we do in robotics, which is a partial nephrectomy, where we remove a tumor that is in the kidney while preserving the remainder of the kidney.
A urology resident knew that I had a 3D printer and knew that Ghazi wanted to make 3D models, and he linked us, and I was able to work with Ghazi and make realistic-looking organs for people to practice surgery on. 3D printing is a perfect outlet for creativity and innovation. The 3D printer is basically a fancy hot glue gun. Over time, based on the movements of the print head, the 3D model is generated. We start with their imaging, and that can be any imaging modality. It can be CT scan, MRI, ultrasound. You take the raw data and you convert that into the virtual model. Once you have it in the computer, you go slice by slice, and you're able to generate all the different components that are in that image.
We stumbled across this hydrogel that enabled us, based on the concentration and certain processing, we can add color to and we can change the texture of it. And it's actually 70% water, so it simulates the human body, which is also 70% water. We create a negative mold, and then we inject that mold with that gel, and through processing, we then have the kidney.
Our first kidney that we made was this small, dark purple kidney, and our only goal at that point was it had to bleed. And it did bleed, and it was amazing. And the first time we cut into it, our heart rates went up, and we thought, wow, we're really onto something. We think of it as a science, although at its heart, it's really arts and crafts, because we are creating sculptures that just happen to be anatomical. When we're making fat, it's really soft and squishy, and when we're making muscle, it's more firm, and it actually tears in kind of a striated fashion. So we came up with, along the way, a lot of tricks in order to get each component to feel like its original anatomy.
We have not only a model that you can cut into that bleeds, but we have a model that we can then incorporate into half the patient's abdomen, and then it becomes an entire procedure.
We take all the components and stack them in anatomical layers into our simulated body cavity.
We added a urine collection cavity, which is normal for a kidney, different grades of tumors and different difficulties of the tumors, the blood supply of the kidney, the main artery, which is the main vessel that supplies the kidney, and the main vessel that drains the kidney. And we added the bowels, the fat around the kidney, and the spleen on the left side, which is the organ that harbors the kidney. Because if you're going to do this procedure, you first have to clear everything off the kidney. So we wanted to recreate the procedure from beginning to end, and that's what we call full procedural simulation.
Then we take it to the operating room where we complete the simulation experience. And we really want that to be a realistic environment. We want there to be all the same tools and the same equipment that they would normally use in the OR. As they run through the exercise, the interaction with the physiology of the organ is critical. You can see the different bags of body fluids that are running into the simulation, because this is most effective.
As an experienced surgeon, I'm working on it. It's hard to tell. It's not a patient I'm working on.
There's two general categories that the simulation can fall into. It can be an idealized model, or it can be a patient-specific model.
These models give you the ability to practice prior to doing the surgery.
In the simulation setting, you can recreate, you can create potential complications, how you'd handle it. So complex cases, you render them simple using the simulation technology.
It's like you're traveling in the future, doing the procedure, and then going back and saying, oh, this is what I'm going to do when I really do the procedure. I could predict where every vessel was. I could prevent bleeding before it happened. And it was like really predicting what was going to happen in the operating room. I was able to have this insight that nobody else was able to have unless they actually do the procedure.
Medical student surgical education is really lacking because they can't try out any surgical procedures. They really just watch. And you can imagine how hard that would be for a medical student to choose a career in surgery without ever having performed a real operation themselves.
Our third-year surgical clerkship at the University of Rochester offers a hands-on course for them to do an entire procedure, a laparoscopic cholecystectomy, which is removal of the gallbladder through small incisions. It really is realistic to them. They not only learn the technical skills required, but they do that in a format where they're actually learning the steps of the procedure. And I can bet you that we're going to graduate a lot more people that go into surgery from now on because we were able to recreate an experience.
We have projects with urology, OBGYN, neurosurgery, vascular surgery. We're starting to do orthopedics and ENT as well.
We believe so far in the last 3 years we've worked on this that we can recreate any part of the body.
We create anatomy, but the pathology we can interchange very easily. And so you can easily go from a trauma model to a tumor model to a vascular model and modify just small pieces of the anatomy and end up with a completely different set of circumstances.
So the fact that we can have surgeons practice their own procedure before going in and patients asking their surgeons, how did the rehearsal go yesterday? That's going to be the future of surgery.